Mr. Speaker, it's my pleasure to be here this evening to join my colleagues to talk about Medicare. As you may know, before coming to Congress, I served as a general surgeon in my district for the last 30 years, and many of my patients were on Medicare. And as a practicing physician, I often express to my patients and my understanding wife about our broken healthcare system here in America. In fact, that's one of the reasons I decided to get more involved in the political process and actually run for Congress. Most Americans don't understand that Medicare will be bankrupt within a decade if we don't do something to fix it. I didn't make this up. An actuary for the Centers of Medicare and Medicaid Services actually provided this number. Now, I think if you ask most 65-year-olds just beginning to use Medicare, most would be very worried to learn that their primary health care provider was projected to be bankrupt within a decade. In fact, according to a recent Social Security Trustees report, Medicare seniors should expect to see a 22% benefit cut, or workers should expect to see a 22% hike in their payroll taxes unless some action is taken. The bottom line is, if action isn't taken today, seniors in the program today, not to mention those looking to retire in the near future, will begin to lose their benefits. Despite these facts, the other side of the aisle has spent the last 6 months attacking us, often saying that House Republicans' attempt to protect and preserve Medicare was in fact destroying it. Are you kidding me? Accusing myself and my fellow physicians in the House of wanting to end Medicare? We spent our careers caring for Medicare patients and are proud now to call them constituents. The real truth of the matter is that President Obama was elected in 2008 with a promise of hope and change. He did accomplish change in America's healthcare system, but I don't think it's the kind of change that Americans bargained for. Mr. Obama's health care law cut $575 billion from an already ailing Medicare system. The name of Mr. Obama's health care bill is the Patient Protection and Affordable Care Act. Mr. Speaker, I ask you, what type of patient protection cuts $14.6 billion from nursing homes, $112 billion from hospitals, and $135 billion from Medicare Advantage? While I'm on the record extensively for balancing the budget, I do not believe that our health care system should be made affordable on the backs of America's seniors. If the $500 billion in cuts made by Obamacare were not bad enough, this bill did nothing to address the nearly 28% cuts to physician payments scheduled for January 1st of 2012. I believe in providing access for America's seniors, not taking it away. I'm happy to announce here tonight that I'm working with members of the Doctors' Caucus, House leadership, and members across the aisle to develop legislation that will solve this issue once and for all. Mr. Speaker, tonight I call on all my colleagues to work together to ensure America's seniors that America will continue to be there for them in their time of need. I have made a pledge to seniors in my district that I will not support any changes to Medicare benefits for those 55 years of age or older. It is my belief that for those aged 54 years of age or younger, some reforms will be necessary to guarantee that Medicare remains solvent in the long term for our children and our grandchildren. Mr. Speaker, we are here tonight to show that as physicians, we want to preserve Medicare for the future. I thank Dr. Fleming for organizing this special order hour, and I yield the remainder of my time.